Good afternoon. You had a long trip. We have had the privilege of visiting some of the facilities created to deal with these challenges of the pandemic. We have visited few of the areas, as you also have seen since you were following the convoy. Thank you for covering the whole visit. Now, as we reviewed the case with the government on a number of occasions last year, this year similarly we had one review which was chaired by the Honorable Speaker, wherein the members present there, which represented the opposition as well, including myself, have looked at all the necessary measures required to be put in place specific to deal with this second wave of the pandemic. We did look at areas which needed to be attended by the government, particularly in respect of ramping up the facilities across different districts, and also the various other collateral measures which are required to be put in place. Now, the government's response to our observation has been that there has been a response to, but then very sluggish. Today we have visited the dedicated hospital in Jowai, where the measures to ensure that we have enough oxygenated beds are in progress. We also visited the designated corona care center, which is yet to be operational. In fact, it has been just made ready. And two of the corona care centers being managed by the community themselves. And one of them is only ready. It's not yet operationalized. So, to be practical, we saw only one which is operational, where we have a few cases there. So, our observation based on these and earlier inputs that we have received is that the government need to provide the necessary support to the health department. When we look at the support that has been provided are completely inadequate, and even whatever is being provided is in the process of implementation, which gives us reason to believe that the overall preparedness was completely missing, and unfortunately that has resulted in painful experience for all of us, wherein we have lost precious lives. So measures that could have prevented the number of incidents and measures that could have saved precious lives. So those two things are seen to be wanting. Now, here in Jowai, the dedicated COVID hospital, where all the measures for providing oxygenated beds are in progress. You have yourself been there as a witness. So piping is on. We only hope that it will be completed sooner than later, so that at least the burden of referring the patients to Shillong can be avoided. I had all the inputs based on our conversation with people from different districts. Now, particularly this Jowai Hills region, most of the patients were compelled to be shifted to Shillong. And this is precisely because of the inadequate facilities in Jowai itself, which in turn add extra burden on the availability of beds for the COVID patients in Shillong. Most of the private hospitals in Shillong are flooded by patients from other parts of the state, from Jowai and from Jowai Hills. This is because the facilities which could have been created here on time were not done. Therefore, the government has to provide the necessary support to the health department. The necessary support in time, not just the support, but in time. And even as we talk today, since we really don't know how the virus is going to behave, we have to keep in mind that after the second wave, we need to be prepared for the third wave. Last year when we interacted with all of you, I have said that based on what we know of the past pandemic of this nature, particularly when it is a pandemic associated with virus, then you'll always see waves after waves coming. And the kind of pandemic that has happened in the past give us enough inputs. We had access to all the well-documented informations available about the past pandemic. So from there only we have to apprehend that pandemic of this nature will keep on confronting us with waves after waves. Therefore, keeping in mind the likelihood of the virus to mutate and further create surprises, we need to be prepared. Therefore, it will be in the fitness of things that all the line departments who need to come together and fight this war against the virus must be provided all the necessary support. We must have enough exhaustive auditing done in respect of our capabilities to fight against the virus. Because when we are at war, we need to know how prepared we are. Are the arsenal enough? Keeping in mind the enemy's arsenal, the wherewithal that we need to have. So we need to continue in our effort to see that all the necessary support is provided to all the line departments, particularly the health department. Today, one important thing which I want to share with you is that while we have the oxygenated beds, and when we need to look at transferring the patients because of the severity who will require ventilator, you'll also have to have manpower. Now, this manpower auditing has not been done properly. That's why we don't have whatever ventilators are available not being put to use. This is precisely what is happening in other districts. Talk about Garo Hills, talk about Jowai Hills. We should have enough manpower. We have to send our doctors for training, particularly in view of the fact that we don't have enough anesthetists. We need anesthetists to operate the ventilators, to take care of the patients who are compelled to be supported by the ventilators. And we all know about our strength. How many anesthetists do we have? Even for normal operations. And knowing fully well all these deficiencies, all these weaknesses, it is very important for us, since we know that we are going to fight against the enemy, if we need to ramp up our capability, our arsenal. That is how you ramp up your arsenal, your capability. And I'm sad to see that this has not been done, but I have had an interaction. In fact, even before this, I have been talking to the director, DHS, the other senior officers. Look at the alarming number of death count on a daily basis. And look at the percentage of the death. If you're looking at the death count, it's more than 2%. Anything beyond 1% is a matter of concern. And if you look at the cause of this high death count, then we are able to also know many things which revolves around the deficiencies. And these deficiencies must be taken care of to avoid loss of precious lives. Dealing with these serious COVID patients, as per the progression of the disease when the patients require to be shifted to ICU. If the patient required to be shifted from one district to another, the precious time which is wasted in the shifting of the patient and the challenges of getting back after getting referred or after being shifted, that is where precious time is wasted. And subsequently, besides the burden or the pressure on the hospitals in the state capital, you end up adding more severe cases to those hospitals. So every facility is required to be created for the giant tails region in Jowai, for gargoyles region in Tura, and we cannot have any other option but to do it. And we'll be taking it up further after this. I wish all my beloved families whose patients are in different COVID care centers, community COVID care centers, institutional COVID care centers, and some of them who are in hospitals. I wish all of them a speedy and complete recovery. And also, we convey our deepest condolences to all the family members who have lost their loved ones during our fight against this pandemic. In addition to any new infrastructure proposed to be created, what is required is to look at what are the existing infrastructure available. Okay. And ramp up the facilities in this existing infrastructure. Today, we have seen here in Jowai itself. We have come here because we wanted to see in the ground zero. Now, this facility is capable of taking care of quite a substantial number of patients. The problem is that the facilities which should have been provided here and the need to ramp up these infrastructural facilities were not done on time. Now, existing infrastructure, say for example, we talked to our friends in Jowai. We wanted the maternity and child hospital building which is completed in, what is the name of that place? In Jowai. Just after Umsmi. No, before Umsmi. I myself laid the foundations from that building. Umrah. Now, these are existing facilities. I am giving you an example. Okay. The one which we have visited today, these are existing facilities. We have many other facilities which can be optimally utilized if fully equipped. Now, in addition to that, as I have said, equip the infrastructure. Also, see how you can have the ready manpower, because they will be there as the frontline warriors. That is also missing. As I have shared before you, if you create more ICU beds, if the patients, based on the progression of the case, require more patients require to be put under ventilator, you will require adequate manpower who are trained. We don't have, as of now, we don't have. So we need to understand all these deficiencies and prepare. We cannot shut the stable door after the horse has bolted, because our job is specific, and we must be focused, saving the precious lives while fighting against the pandemic.